The question arises, why is the brain so important? Well, an older man said there are three things that they can't take from you. One is what you've learned. Number two is the memories and your experience. And number three is the joys and the sorrows you've had. However, the fact is, if you don't have your memories, you really can't enjoy the other things. You won't remember what you learned. You aren't going to be able to relive those memories, the emotions, the excitement. So memory is very important, and that is why your brain is so important. It is very important for you to take care of it. This is Dr. J. Sordian urging you to save your brain every day. So the question is, what is memory? Well, memory is a part of what is generally called cognitive function. That's our ability to think through things, remember things, discern between different objects, figure out where we are in time and space. So memory is one part of cognitive abilities. Now, where does dementia and Alzheimer's fall into that whole category? Well, dementia is a larger category of the loss of memory. Various degrees of inability to remember short-term events or even long-term events. Alzheimer's is a subcategory underneath dementia. Parkinson's also falls under that, alcoholic dementia. There are a variety of different types of dementia, and Alzheimer's is one of those underneath the category of dementia. And memory loss is the larger category of dementia. Dr. J. Sordian urging you to take care of your brain every day because it is so valuable. If you would like to get a whole series of these videos, all 20 videos, that explain the brain and talk to you about how you can improve your brain and take care of your memory, please go to SuperBrain-TheBook.com and sign up there. SuperBrain-TheBook.com, and you will get them promptly. Thank you. So, why should you take care of your memory even though you seem to have an excellent memory? Well, once again, I think in the previous sessions we've talked about how memory is so important to your life, to your ability to interact with other people, for your relationships, for your livelihood. Memory is a key function that without, it is very difficult to actually get by in the world. So take care of your memory. Take care of your brain every day. Dr. J. Sordian reminding you of how valuable your brain is. Now, I meet many people and I do many lectures on the brain and memory. And with older people, even if they are not noticing much going on with their memory, or even if they are, they don't tend to pay it much heed. They let it go until it has degenerated so far that there's much, much less that can be done about it. Well, the same thing goes for younger people. It is known that depression comes along with dementia and memory loss. At the same time, younger women, studies have shown, may be having depression, and yet it might actually be a memory issue. So it's very important early on to figure out how good your memory is and keep checking it periodically with professionals who have an outside objective standard, because the more your memory starts to go down, the less you are going to be realizing that it's the case. Other people around you will notice it's very hard for you yourself to be aware of when your memory is collapsing. Dr. J. Sordian urging you to take care of your brain every day. Hi, Dr. J here. Now, what is it that doctors typically will do with respect to keeping track of how your memory and brain is working? Well, there are some general principles. If you go in the doctor's office, they will ask you some questions, see if you're tracking, things like that. But in general, unless you are doing a large annual physical or a comprehensive physical, you are not actually going to get anyone to be paying attention clearly. No medical professional nowadays is really watching out for your memory at an early age, and this is tragic because your memory is so important. So it's very important to seek out professionals like myself and others who actually care about your memory at an early age, and we'll actually, we do have methods to track it and see how well it's doing so that you can have benchmarks and you can actually take action and deal with those things that you are able to actually change in your life. And I'll talk more about those in other segments. There are only a few physicians and doctors and alternative medical practitioners who are spending the time and focusing to include in their own evaluations how individuals' memories are. And why is it that others aren't? Well, I have no idea, except for the fact that insurance is cutting time down to the barest minimum, and doctors are losing money right and left and quitting right and left because the insurance industry, if they are relying on insurance to pay for the time you spend with them, they can spend very little time with you because of the overhead costs. I understand that personally. Overhead costs of running a practice is very high compared to what insurance companies are willing to pay. Insurance companies are only paying for just dealing with symptoms, primarily. So it's very difficult for a doctor to spend the time necessary to actually evaluate you carefully. So what do I do though? We do a screening. We provide a variety of symptom surveys straight up at the beginning and periodically with patients that we're working with, in order to track how well people's memory is and how well we are doing with helping to improve their overall brain function. This is something that is very important for you to do, and you need to seek out individuals who will do that for you. Dr. J. Sordian, urging you every day to take care of your brain because it is very valuable.